J.T. Mitchell has a good article. Mississippi Supreme Court has set a date for the oral arguments to be heard in the city of Madison's lawsuit challenging the legitimacy of the Initiative 65, the medical marijuana program approved by a majority of Mississippians. Arguments in the case labeled Mary Hawkins Butler versus Michael Watson will begin April of the 14th, which is a lot longer than I thought, but anyway, the lieutenant governor is with us. You can respond to that if you want to, but as a lawyer, they're taking their time on this.
They take their time on everything, Paul.
As former lawyers. Yeah.
We've got cases with the Jackson Airport that's been there 4 years, and we hadn't had a trial yet, so whatever.
Initiative 65 proposed to change our Constitution to add provisions that create problems for municipalities, et cetera, et cetera. Well, I'm not going to go into the whole story, but you can read the article on our new news site, supertalk.fm. How are you doing?
We're doing good. It's a good
you
day.
and I were talking. You said that you had more reaction from the first shot than the second shot.
Yeah, the first one, the next day I got up and everything hurt and creaky and felt like the dickens. And then the next morning you got up and you were like you never had it before. So, but I had a pretty severe case of COVID, I guess. I didn't end up in the hospital like so many others have, but we had a bunch. It was a pretty tough couple of weeks.
Where are we now as far as the Senate?
I think we got 40.
Have 4?
We have 5.
5 now?
Yeah.
Okay.
We have one that's come back that's on oxygen, and then all of them are chairman of something, and most of them are very meaningful committees, and so our contact has forced everyone from my executive secretary to our staff members and everything are now in quarantine, and it's very difficult.
Are you able to do what you need to do without delaying the session or extending the session?
Well, we're going to meet the deadline. We've been working with our vice chairman. We were down there till 8 or 9 o'clock on Thursday, working with one of them. That's very important, and he's in up to his neck in over the weekend, and we intend to meet our deadlines.
The news that I've been reading about the variant strains of this thing is a little worrisome, but we keep hearing that the vaccination should take care of that. It's applicable to the new strains.
That's correct.
We got to get it out there.
Regardless of that, there'll be other strains, but regardless of that, everyone needs to be vaccinated as quickly as possible.
Speak to this. What do you think are the rollout of this as far as the availability of vaccines? It looks like, in your mind now so far, what does it look like, and when will it get better?
I think the health department and particularly our National Guard and General Boyce Group have done a phenomenal job in rolling it out. And I think there's only 18 or 20 locations right now. But we shouldn't confuse distribution with availability. If we don't get the vaccine, it doesn't matter if we had anybody on every corner. We can't put them in the arms. I think we got 40,000 this week, and it's gradually picking up. I wish there were more of it. Quite frankly, it's a miracle that we got any in 9 months to go through those trials like we did. That's really that Operation Warp Speed that President Trump did was a phenomenal success. But we're in the process, and I encourage everybody that possibly can to get in line. Right now we're over 65 and older, and then now we'll be getting into law enforcement and everybody else.
I will say and I feel for people who don't have anybody at home or who is adequate on a computer or something, or
very difficult,
doesn't have family to help them out, and they can't do these things, because you have to be very vigilant. You have to stay after to get it booked.
Right. We have people going from people that I knew in Vicksburg drove to Natchez, and people in Jackson drove to Morton or Forest, wherever, and people are having to move around to get this, but it's worth the effort, and I encourage everybody to do that. This is a short-term issue here about the distribution. We should be through this by summertime. But unfortunately, we have these virulent new streams of this that are coming at us, so the quicker we can get it done, the better.
One thing over the weekend, we heard that FEMA has obligated $32 million to the state of Mississippi for cost for the COVID-19 vaccine missions, which means that as far as the state's kitty, it's going to be helpful.
Right, it'll be helpful to the Department of Health.
MEMA's new executive director, Stephen McCraney, said that this money will help the state to administer the vaccine.
That's
the
correct.
Assistant for Vaccination Efforts will make a tremendous impact at the expenses incurred by the state of Mississippi, which one way or the other we have to pay for.
That's correct. We're picking up a lot of overtime and a lot of expenses. Obviously, this distribution is not free. And again, I want to thanks so much our Army and National Guard troops about what they're doing for us.
Will we see the expansion of this, as far as you know, as different locations like it, maybe at the Walgreens or the Walmarts?
Yes, and that's part of our problem. I want to go back again to the availability. We did not get to the nursing homes as quickly as we should have. Now, we is Walgreens. We might as well call it out what it is. And about 2 weeks ago, we realized that they were not making the distributions. And in conference calls with our chairman of public health and others, when they were pressing on this issue, Walgreens said, well, we don't have enough people to get to all of the nursing homes. Well, that's you knew that when you signed the contract to distribute it. So we have been able to accelerate that. Quite frankly, it should have been done a month earlier. But to get to our nursing homes and assisted living homes and that kind of thing, they're getting them now. But there was a long delay that should not have occurred, Paul, and it was because Walgreens was the one authorized to go to those places and distribute this.
So even if we had more vaccine, we'd probably have to leave it there or give it to somebody else. Because
we don't give it to anybody. I mean, that's why the governor opened it to age 65. So we could go ahead and use the ones that were given to us. I believe. Why
was it in some states, though, Governor, that you had them going outside the mandates of Walgreens and CVS?
That's what we ended up doing.
Yeah, absolutely. But apparently they had been doing it for a while. They went to Publix, they went to Kroger, and they had a multitude.
Well,
we heard from here that those were the only places. What we were doing is the only place, other than in the long-term care facilities and the nursing homes.
Right. That's correct. This all went on with about 2 weeks ago, so I said that would have made it about the second or third week in January when we realized they were not being delivered as they should have been 2 or 3 weeks before that. So it was a pretty real-time effort, I think, on our public health chairman and us to push this with Walgreens.
Since I was talking about liquor and wine, I'm a little bit surprised how many bills are moving, how fast they're moving through.
Well,
Looks
I'm
like
not.
Something's going to happen, and I'm just not sure exactly what's going to happen. But as Lieutenant Governor, what do you think?
Well,
where we're going to go with this?
I can tell you we're not staying where we are. Without question. We back in February before this hit, I had an unannounced visit. I just went out and knocked on the door and went in. I like to do that. Just you can't get a feel for things off paper. You have to go there. So I went out.
I'm sure they loved that too.
They were a little surprised at that. Well, whatever. Yes. So anyway, I went through the whole thing. They're very nice and very accommodating to show me, but the equipment is it's archaic and falling apart. The roller system they delivered tears up the boxes. There are broken boxes around. There's all kinds of issues out there on the actual delivery, and the warehouse itself is I would consider poor.
Maybe they weren't complaining because some of those bottles were broken that they had to discard.
I don't know. I don't know about that.
I'm just saying I can verify what he is saying.
Is that right?
So,
exactly.
And so it is in difficult shape, and we have 2 or 3 choices. Obviously, when I talk to one of those guys that works at night up there, they load all these boxes and everything. They pick up about 30 to 35,000 pounds a night by picking up individually. And I'm surprised that they're anybody working out there, or if they are, they're in really good shape. I can tell you that they don't have to go working at the gym.
Well, the primitive stuff they have is not their fault. It's the legislature's fault.
It is not their fault. It's not sustainable where we are. Mm-hmm. We have issues with the fact that we don't charge any bailment. Now, bailment is a big word for rent. We got stacks of vodka, whatever this Ticos or whatever it is. We've got stacks and stacks of that. We're not charging anybody for that. I mean, it's just out there occupying our warehouse space. The system.
Wait.
What?
We didn't order that. They just warehoused it.
We ordered it. I assume we ordered it, but we're warehousing a lot of things for a lot of liquor companies that's not just in time inventory like they do at Nissan or something like that. So and some of that has to do with the fact we don't have a WAN system. We have no way to really keep up with other than counting. Our people are working hard out there. It's just this system is archaic. It just needs to be changed, and whether that ends up in some kind of private operations or some kind of combination. I think all of those are on the table.
Sounds like someone in a real technological field going into a building and saying, let's see if I can figure out what's wrong with
look,
and then looking at their typewriters and says, well, this may take me a couple of months to figure this out.
We're getting close, but you look at Pepsi-Cola or beer distributors or others, and they do this thousands of cases with up-to-date equipment. We're just behind, and we need to address one way or another, and I expect something will come this year.
I'm going to ask you how much, and what do you think something is that will come when we come back after a couple of drinks of coffee. Back with more. Now, wrap up this thing on the liquor.
Yeah.
So there are numerous House and Senate bills, but it looks like right now people are leaning to those people who are small businesses that have liquor licenses.
Yeah, about 1,800 of them.
Is it that many?
Yeah.
Do they have to worry about maybe going out of business by this is going to be put in grocery stores and the grocery stores are going to compete with them? How many of those bills are out there that do that? 'Cause
short answer is no. The grocery store legislation that's been proposed has to do with wine below a certain alcohol level and no liquor.
That's already there, right?
Right. And no, it'd be raised up to a level like you would see in when you go to another state. You see they have these regular bottles of wine like you get in a current liquor store.
Wait a minute. So there is a bill that raises the limit of alcohol in grocery stores.
I believe there is, and there have been. I believe there's a couple of those actually where the grocery stores would be able to sell wine, basically.
Well, that's going to a great portion of some liquor stores' sales.
It's sale of wine. That's correct.
Well, is anybody doing anything for them?
It came up last year, and the liquor stores. The bill died on the floor. It was actually defeated on the floor of the Senate.
Problem we have is not doing something for them because they're some of the more regulated small businesses in the state. You can tell them when they can open, where they can open, how long they can open, and things such as that. So.
We tried to do a bill that would allow the direct shipment of wine to the liquor stores. Like you could go down and order whatever you wanted to order from the liquor, and it would be directly shipped to them. That bill died too last year. So it's kind of an interesting dynamics of it as to what's going on.
Speaking of business, there are a lot of things happening as far as business. Where's the influx?
It is roaring along. It's kind of scary because I can't find anybody against it. It must be too good. We have
stand by.
We have all of our economic developers and our bankers and our businessmen and women all over all for this very simple form that requires transparency. We pay in arrears, Paul, under this program. So if you tell me you're going to bring 50 employees and you bring 30, you get 30 tax benefits.
Yeah.
If you bring 80, you get 80 tax benefits. Those are retroactive. And we also have an accounting system where you have to report what you actually did with the money on an annual report back to the legislature. So this transparency and this retroactive payment is very good. It's very simple. I sat down with a company that's looking at coming to Mississippi the other day, and we were able to figure their tax breaks in about 4 or 5 minutes. And that went from, right now we have 31 different tax breaks by, you can take a whole law firm and CPA firm.
Are other states doing this?
No.
So in other words, if a company wants to move in here from California and they're looking for how competitive we are as far as breaks are concerned, they just this is what I want to bring, and this is exactly
all
they
they
can
have
look
to
on
tell
the tablet.
me.
It's there.
We calculate it by how many jobs you have, whether or not those jobs are going to exceed the county average. You get a bump in your break if it exceeds the county average by 10%, and then another break if it exceeds by 30%. How much capital are you going to put in here, and how much furniture, fixture, and equipment you take? If you know what that is and your projections are, you can figure your tax benefit sitting in California.
There's no up or down adjustment in that?
There is. It's retroactive. We pay you after you get here.
After you get here.
Yeah, we don't send you a check and say,
we used to have something called clawback, but apparently we didn't.
That never worked, Paul.
Why didn't that work?
But,
it sounds like the same thing as this.
I can't. I'm not speaking for anybody before my time, but I never liked a clawback, and we never clawed anything back. The only thing that got clawed was Mississippi taxpayers.
That's true. That's why I'm wondering what's different between the clawback and this bill.
This one we pay retroactive. Like I told you, if you tell me you're going to bring 100 jobs, we all have a big shovel breaking and we break ground and all that other. But if you show it with 30, you only get 30.
So does this need to be on the governor's desk?
It will be.
You said that you already talked to some businesses about it, but businesses, they like it.
Everybody likes it. We gave it to MDA in December. They gave me back their comments about 2 weeks ago. They're very enthusiastic to sell the bill. They think they can use it.
It's in their sales brochure. They're
it will
using
be very.
this
It
now.
will be. No, it's got to pass the law. It's got to pass the Senate and the House, and then the governor's got to sign it. But then it'll go to MDA, and they were very pleased with it and very simplified a lot of things. And the reporting and disclosure was real important to me, Paul.
It seems that you are more against any tax reform right now than the leadership in the House. What's your stance on it as we get into the month of February?
We have a $5.5 billion budget. About $2 billion goes to education. A little bit more than that. About 40% of our entire budget. To eliminate the income tax is about $2 billion. So it kind of equates. We can have tax reform, Paul. The way to do that is not on the whim and a prayer that we're going to get more money in. It's to address our current system. So if we downsize government to where we can use less money to operate, that's a surefire way to be able to cut taxes. There are others. If you want to raise the tax on something and lower the tax on something else, that's a public debate that's held in the Senate and the House.
Isn't that what's going on, though? That's... When you look at the bills.
You can't just whiff this. You can't say, I'm going to eliminate the tax. It's $2 billion. Now, what am I going to do to educate my children?
But who's doing that?
Who's in the state of it, for starters?
No. What I'm asking you is the people I've talked to, they all have a plan to step into this on a gradual basis, doing the things that you mentioned.
Right, but what they don't have is the plan to provide the income to offset it. So I'm very much amenable to any kind of discussion that we can lower the cost of government. That's one way to pay for it. Rearrange. Do you want to raise the sales tax and lower the income tax? That's a discussion to have.
Nobody's put that in writing yet, is what you're saying.
No, not that I've seen. Okay. If you want to raise the gas tax and lower the income tax, we could. I mean, that's a public debate you could have. It's about $22 million per every cent gallon of gas tax.
User tax about the only other way to go to make that up.
Well, mostly, yeah. And if otherwise, you have to raise your ad valorem taxes. Like Tennessee charges 9% sales tax. We charge 7%. They don't have an income tax. And they still run their government. There's no panacea here. There's still an income stream.
I burn
But we can do this. We can address the tax structure of Mississippi, and I am amenable to that. I've got a little background in it. I did it for 35 years. So I'm not only amenable, I'm encouraging about that.
Well, when does that discussion happen? Because we're halfway through the session between you and leadership in the House.
We have had preliminary discussions, but there's no firm proposal yet, okay? And the way that we work, as you've seen, the Senate had hearings in September and October and November on tourism and on business and on insurance and on health care and on...
But not this.
We didn't have any hearings about this. And so we're not prepared to just knee-jerk here in February... change the system of taxation.
Does this seem like it's going to go into a study committee? I mean, is that where we're leading?
Probably. There may be some proposals that come out to do just what I was mentioning to you. All right, let's go raise the gas tax 2 cents and lower the income tax. The 4% rate is about 160, I think, or around $200 million of that $2 billion. So you could eliminate that by raising something else. It's just different. It's just different mixes that come out with the recipe, and everybody's open to any discussion. The reallocation of taxes is a very strong political discussion.
Yeah. Why don't we go on and just bite the bullet and do the medical or the recreational marijuana?
I think we should.
I'm saying recreational.
No, I'm talking about medical marijuana, not recreational.
But if you do,
I didn't like the first one, but
I didn't either.
People have voted for it, so we're going on. We need to get on with it. It's in the Constitution.
I was going to say I burn people's ears when I say this, but I'm just saying that we've been pushed into a corner, and now how do you get out of it?
Well,
because our medical marijuana is as close to recreational marijuana than any other state's medical marijuana.
I think that's accurate, and
we don't get a penny.
We don't get a penny, but I think the way to handle this, to me, is to go ahead. The people have spoken. We need to go ahead and have medical marijuana. We need to do a bill.
Well, we're going to do it, but we have one working its way through, medical marijuana bill, but I don't understand this one. As an attorney, too, tell me how that works. If the governor signed this tomorrow, how does that work?
Well, we'd start the process. The other one has a whole series of things you have to do under the Constitution. This bill would effectively have some limitations on where you could put it. Would have a taxation feature.
But we're competing with a government liquor store versus a private sector liquor store, and the private sector is probably going to win on that. So why would we even do that?
I don't think that's accurate. You'd still have people that would have, if you went with medical marijuana, you'd still have people selling under one bill, and you could have people selling under. Both would be in the private enterprise. It wouldn't be a government anything.
Some cities would not. They would be able to opt out for the most part.
I think there's one of the bills I saw. There's at least one distribution in every county, but everybody with 30,000 or more would have to be able to have additional locations.
Oh, this time passes too fast. We got other topics. Let's see if we can cover some of them coming back with the Lieutenant Governor next.
We're covering from liquor to marijuana. You're going for good stimulants. You got it covered.
I'm getting a little dizzy here. Delbert Hosemann. Wish we had more time here because it flies by. One of the things talking about making this shift, doing it gradually as far as being competitive, certainly as a southern state, for the income tax, which seems like a good idea all around, but it's doing it in a cautious time with this the new administration out there. I was just looking at the oil and gas executive orders, some of them for the off the shores of the Gulf Coast.
I don't think he read any of that stuff.
I don't think so either.
He had a stack about this high, and he
was actually saying I don't know what I'm saying.
Without question, and I saw in New Mexico is 117,000 jobs are related either directly or indirectly. He's crippling the economy. We just got independence. China is challenging us over Taiwan. His biggest foreign step has been to join the Paris Accord. I just don't know that he's focused on all of this. I think some of this must be.
And now we have an international crisis back. You didn't hear this in 4 years. It was very peaceful. U.S. Secretary of State Blinken has condemned reports that the Burmese military took control of the country, detained senior leaders, including of their de facto leader, and called for the military to reverse these actions. It's Biden's first international crisis, so here we go again.
It's not going to be his last. We pray for the president and make good decisions, but I think the rapidity that he has signed these executive offers without really more of a political decision as opposed to an economic and reality decision, and that comes with hopefully more maturity in the office. Maybe this will get better. A lot of those will be stopped in the courts, and there'll be a lot of litigation. But there was no need to do that.
See if we can play fastball. We only got about 3 minutes left here. Some things that you want to mention that are going on that we need to take care of.
We got a teacher pay raise. It came out unanimously from the Senate, and I think the House has got a similar bill. Very enthusiastic about that. Looking hard at tourism, Paul. We need to rebound in our tourism industry in Mississippi, and the way to do that is to have our own agency with that. Same number of employees and everything. It's now sheltered under MDA, but it deserves its own light, and head of it would be...
There are bills out there for that?
Yes, sir, coming out of the Senate. We have that going. We have a big fiber bill. We're going to lease the dark fiber that Mississippi Power and others have so that the individuals will have a greater access to the Internet, particularly our kids and whatnot. We're looking. We have a bill coming out of the Senate to require every nonprofit or anybody that gets state money to report at the end of the year what they did with it, so we don't have the same kind of issues we had this last time coming out with money missing and whatnot. So a lot of very, very active things are going on in the Senate side.
From the Lieutenant Governor's viewpoint, and you heard some of the conversations last week with the doctors on ophthalmology, physical therapy. Where do you think that stands in the Senate?
I expect we'll have a scope of practice bill out probably today or tomorrow that will address the issues that scope of practice for a lot of different groups. Senator
a bill that will expand the scope of practice, or
mainly it will expand, I think, the scope of practice in some areas. Senator Bryan, I'm going to meet with him today. He's been working on this for about a year, and I think he's ready to bring his bill out, and we'll see what he comes out with. There are a number of different practices that make sense to have some additional opportunities in the nursing area and optometry area and others. So I think that will come out today or tomorrow.
And I was thinking about it over the weekend because we had a lot of feedback back and forth as far as nurse practitioners. But I think the patients, the general population, is over the years have become confused. And I say that because we hear nurse practitioner, and then we have to understand what is the legitimacy of, not the legitimacy, but the level of training. Then we go to a family practice or a heart doctor or somebody, and that doctor's not there. We saw there's a nurse practitioner. Then it's the medical profession itself who's created some of this problem.
Well, most everybody that has a regular internal medicine or regular physician knows that the nurse is the one you talk to most of the time. Yeah. His head nurse or her head nurse is the one you deal with most of the time. And they have a scope of practice. They have things that they do that are routinely. But a doctor is much better trained to catch things that could go wrong and prescriptions that could go wrong and things like that. I think the relationship, the delivery of healthcare is expensive. And in some areas of Mississippi, it's not complete. And so they have to rely on individuals that are not medically licensed, and the relationship between them and the nurse practitioners is very important. I was up at Delta Medical the other day in Leland, Mississippi, and also in Sunflower County, and looking at how they're doing their operations. And there's room there for the delivery of health care. But physicians are the primary driver. They're the captain of the ship.
And then we get the physician's assistants, and then people start asking, wait a minute,
right.
Is this like a lieutenant colonel to a colonel? Is that above or beyond a registered nurse?
And there are different capabilities between the nurses and the doctors, too, for that matter. So I think those relationships will improve as we're going along.
Senate gavel's in at 4 o'clock. You said you had, 5 on the COVID list?
We do, and then we also have all of the contact lists, Paul. I mean, we got a lot of people out, so we're going to have to hustle today and tomorrow.
Always good seeing you, sir.
Thank you very
Stay
much.
Stay in touch.
We will.
Is the Lieutenant Governor of the state, Delbert Hosemann. We'll talk to Drew Snyder, Executive Director of Medicaid. He's in the House coming up at 7.